It's a great pleasure to be joined by Evis Sala, who is Professor of Oncological Imaging at the University of Cambridge. And before that, she ran the body section at Memorial Sloan Kettering in New York, one of the premier cancer hospitals in the world. Professor Sala, thank you for joining us. What are the clinical challenges in introducing AI into radiology?
Thank you very much first for the introduction. It's really lovely to join you for this. So there are several challenges, and I'll start with the clinical challenge because it's an important one. Because unless you have a clinical challenge and you don't develop anything meaningful, you need a challenge to address. And this is probably part of the reason that some of the AI tools developed haven't actually got to being used, because they're not really addressing the pain point of clinical work. So if I have to take the example of prostate cancer, because this is our prime sort of focus, currently, and it's actually quite shocking, we're still detecting prostate cancer very late. The recent National Prostate Cancer Audit highlighted the fact that in 47% of men, we detect cancer at stage 3 or 4, so beyond the prostate, that has spread beyond the prostate. We use MRI widely, and this brings to the sort of added problem challenges that we don't really have enough people to read those MRIs. We have a shortage of radiologists, which has been accentuated by COVID. So we have a huge backlog. So now not only we have to read those scans quickly, we have to read them accurately. We have a shortage of general radiologists. We certainly do have a shortage of specialized radiologists, because prostate it's quite specialized. So you need a lot of training and expertise to actually do correct reading. So those are really huge challenges that are in front of us. So the AI could really, address both those. First of all, help us with the backlog, but do that with high quality and reproducibility, which is actually key to patient outcome. There is a third added value, which I quite like, is we always forget about education and teaching. This backlog and burning of the radiologists and other disciplines actually has caused us to actually teach less, because we really don't have too much time to teach. And I think we should see AI actually as our teaching assistant, so to speak. So it actually does provide opportunity to help us with teaching, and also provides an opportunity for our new generation to actually start learning with AI. It's going to be part of their life, their professional life, they like it or not. So quicker and better they embrace it, easier will be to actually then run with it and really use it in everyday.